Good morning. My name is Michael Rennie, and I'm going to be doing an assessment on an 11-year-old for respiratory cardiac. This is our patient, Michael. Hi, Michael. Say hello.
Hi.
Okay. Michael is an 11-year-old male with a history of asthma, uses an albuterol MDI with spacer device, admits his symptoms worsen with colds. He's recently finished a regimen of corticosteroids. He uses an MDI albuterol as needed while playing sports. Family history: mother denies a history of asthma, father denies a history of asthma, admits to a history of bronchitis as an adolescent. Lifestyles and personal habits of Michael: he has up until now recently practiced a sedentary lifestyle of low physical activity consisting of recreational activities such as video gaming, reading, and recently joined an adolescent basketball team. And has been experiencing increased difficulty breathing with increased activity of breathing. And this is a verbalized relief with PR and albuterol with MDI spacer inhaler. Patient has recently been treated for upper respiratory infection, is able to cough and clear his secretions freely. Reports secretions are clear in color. Cardiovascular peripheral vascular history: patient denies chest pain, has experienced increased shortness of breath with activity. Family history: mother's father had recent history of heart disease. Mother has history of heart disease. Physical exam: respiratory. The patient has no facial grimacing noted. General in appearance grossly normal. Patient's posture is benign with no signs of distress with breathing. Level of consciousness is a GCS of 15. He remains awake, alert, and oriented. There is no evidence of tracheal deviation. Can you look up, Michael? Can you take a big deep breath in? Okay, and out. Good. Excellent. No evidence of retractions of the chest. One more, Michael. Breathe in. And out. There is some audible wheezing. That's to be expected. Chest rise and expansion appears symmetrical without effort. Room air saturation is 100%. Pulse is 88 and strong. Temperature 36.8, and that was orally. We're going to check blood pressure. Bilateral. Blood pressure on the right is coming up. Respiratory rate is 16. Upon auscultation, there is positive wheezing. The lung sounds are present and clear throughout. Breathe in. Breathe out. Good. In. And one more time. Okay. Excellent. Blood pressure to the right is going to be 122/87. We'll check the left. While the blood pressure is cycling, we're going to get some heart sounds. Okay, so the lung sounds were clear with some crackles to the upper, some coarseness to the lower. He has getting over upper respiratory infection. What I'm going to do now while the blood pressure is cycling is I'm going to get some heart sounds. We're going to go, here we go, I'll take this right off here. Good. Okay, sit up straight. Good. We're going to go to the apex, pulmonic, tricuspid, and the mitral. Blood pressure to the left is 122/87 with a resting pulse of 88. Blood pressures are similar bilaterally. Okay, now intercostal spaces, palpating. They're soft, non-tender. Okay, that's the right, and here's any pain or discomfort. Okay, intercostal spaces are benign. Further percussion of the chest was benign. Auscultated for transmitted voice sounds, benign.